5th expert meeting in developing international herbal pharmacopoeia in Hong Kong. We also take part in drafting part of the herbal medicine monograph and general chapters of the first volume of International Herbal Pharmacopoeia. To looking forward, the Department of Health is going to establish the Hong Kong Center for Medical Product Regulations to harmonize and integrate the regulation of Western medicine, Chinese medicine, and medical devices. We aim to improve the safety and efficacy of drug regulations in Hong Kong, and it will make Hong Kong on the global map as a trust hub for regulatory excellence. The development of Chinese medicine in Hong Kong not only aligns with the national policy, but also aligns with the global traditional medicine strategy. Ladies and gentlemen, this year marks the beginning of the National 15th Five-Year Plan. Under the guidance and support of the country, the Department of Health will join hands with our stakeholders to establish Hong Kong as the bridgehead for the global expansion of Chinese medicine. By integrating rich Chinese medicine culture, scientific research, regulations, and also collaborations, we will promote the modernization and standardization of Chinese medicine and make greater contribution to global health. Thank you.
Thank you, Dr. Mack. Please be seated. 谢谢麦医生. Now let us welcome Dr. Chen Wai-lun, Project Director of the Chinese Medicine Hospital Project Office. 接下来有请香港中医医院发展计划办事处总监张伟林医生 ，Dr. Chen, please.
各位嘉宾、各位讲者、各位同道，大家好。Dear guests, speakers, and colleagues, good morning. Along the direction of development as presented by our commissioner in the blueprint, actually the Chinese Medicine Hospital of Hong Kong will play key roles in multiple development areas. After 7.5 years of planning, design, and development, the Chinese Medicine Hospital of Hong Kong comes to surface in last year, December. The model of the Chinese Medicine Hospital is quite unique. It adopts a public-private partnership model in commissioning the Hong Kong Baptist University to set up a company to operate, manage, and maintain the hospital. The hospital is built by the government and funded by the government. The hospital has very important mission and functions. First two is it will act as a flagship to promote the development of Chinese medicine and also act as a change driver, which means develop and transfer in terms of skills, knowledge, experience, and models. In promoting the service development, education, training, innovation, and research. Apart from the clinical services, education, training, research, equally important is the collaboration. And also, by working together with collaborating partners, we hope to create health values in Chinese medicine. Another very important vision that we want to perform or achieve is to support Chinese medicine going global. On clinical services, of course, as a hospital, we will focus on development of Chinese medicine or integrated Chinese and Western medicine in terms of its application in secondary and tertiary care. However, in primary care, the Chinese Medicine Hospital will also play a very important role in developing service models, get training and research, and try to integrate the Chinese medicine sector into the whole healthcare system. Another unique feature is on the development of integrated Chinese and Western medicine model and the adoption of multidisciplinary clinical teams in implementing care programs to individual patients. The hospital will provide outpatient services, day patient services, inpatient services, and community outreach services. In 5 years' time, that means by 2030, the hospital will have full-scale operation, delivering 400 inpatient beds, of which 20 of the beds will belong to the Clinical Trial and Research Center in promoting the development of proprietary Chinese medicines. And the outpatient attendance per year will be exceeding 400,000. We have adopted an approach of developing specialized CM services, namely the internal medicine in CM, external medicine, gynecology, pediatrics, orthopedic and traumatology, acupuncture, and moxibustion. And within each specialized service, we will select special disease programs to demonstrate the strength of Chinese medicine in defined clinical areas. Apart from pure Chinese medicine, we also will develop integrated Chinese and Western medicine. We hope that by combining the strength of Chinese medicine and Western medicine, by working together, we can create better health to the patients, achieving the 1 + 1 = 3. And the Hong Kong model, because of our healthcare systems, we will like service areas and special programs. On research, we will conduct evidence-based research in Chinese medicine and also integrative medicine. And as I mentioned before, we will also have the Clinical Trial Center to help to promote the development of proprietary Chinese medicines. Collaboration, which is very important, that we aim at locally. We work with our collaborating partners to gather expertise of different institutions to help Chinese medicine and integrated Chinese medicine to merge with our healthcare systems. And internationally, we want to build network and platforms so that we can work together for the better healthcare of peoples of the world. In promoting and creating values of Chinese medicine, we will promote the Chinese medicine cultures and the application of Chinese medicine in daily life. For going global, Hong Kong will leverage the Hong Kong unique advantage on its international connection and as an international city and with the high standard of medical care and research, so that we can be an important window to support Chinese medicine going global. We aspire to showcase techniques and efficacy in conditions in which Chinese medicine and integrative medicine have distinctive advantage. We also want to be an international training center for Chinese medicine skill and knowledge for overseas countries. And we would like to conduct multi-center clinical trial research by gathering strength of different countries together. And hoping our Hong Kong model for integrative and Chinese medicine model could be a reference value for other countries who will consider getting Chinese medicine into their healthcare systems. And today, we are conducting the first meeting of the preparation committee of the Herb Drug Interaction Consortium. And this is a major step as getting integrative medicine, getting herbal medicine, Chinese medicine, and Western medicine drugs together. We need a very well-structured database to facilitate clinical decision. And we hope that by 2027, we will formally establish the consortium next year around the same time in the Chinese Medicine Hospital of Hong Kong. By working together, the success of the Chinese Medicine Hospital will rely on your support. And we hope that by working together with multiple institutions around the globe, we can create better health for communities around the globe. Thank you.